Hello and welcome to another episode of the Rotator Cuff Expert. I'm Dr. Daniel Orcutt. Thanks for joining us. This episode is going to be about whether ice in therapy, supervised therapy after rotator cuff repairs are important or not important. So this question comes up a lot. What should I do? Should I do ice therapy? Should I do heat therapy? Should I buy the cryo cuff? Should I buy the really expensive compressive cryo cuff? Should I go to therapy? How much therapy should I go to? Is it really necessary? So this is actually an article from a few years back from the Journal of Shoulder and Elbow Surgery back in 2017 by Rizzoni et al. And they looked at several studies, so actually 5 studies about PT and 5 studies about ice, and try to get a sense of, does this really matter? So this is what we call a meta-analysis, which means we look at a bunch of studies, we study the study to see if there's good evidence that we should be doing something. The first one, and it's an interesting article because I don't know why they picked PT and ice specifically, because that's what they looked at. They didn't really look at anything else, so interesting. But anyway, they looked at 5 studies that were good enough studies that they could try to take some stuff away. They could take some information away to feel fairly confident that they're giving us the right information. And so 5 PT studies. We're talking about PT, meaning that either it's supervised, which means you go to a therapist, or unsupervised, you do your stuff at home. So when you look at that, 3 of the 5 PT did not show any difference between if you went to supervised or you went to unsupervised. So either you did it at home or you did it with a therapist, didn't show any difference. So that's interesting. 3 out of the 5, one said it was better if you went to supervised. I think a lot of this has to do with what kind of person that the patient is, how well can they go through pain, how well can they understand what they're supposed to be doing. And this shows that there is a role, if we have the right patient in the right situation, that they can probably do it themselves. And I've seen that before. I've seen people come back and say, hey, look at me, doc, I'm doing pretty good. And I said, well, how much therapy did you go? And they said, I didn't go. So we know it's true and possible. It doesn't mean that everybody shouldn't go to therapy, that everybody should have a home exercise program. I think there is huge value in doing therapy, at least for a few sessions, for people to get an idea of what they're supposed to be doing. But I think it's really interesting. If we look at this, 5 studies, 3 said no difference, 1 said difference, and 1 is equivocal. There's some lacking information on the studies because we don't talk about how many visits to therapy. Is 1 visit being supervised? Do you do 12 visits being supervised? Twice a week, once a week, 3 times a week? So there's lots of variables in there that don't really give us perfect information, but it certainly gives us an idea that in the right patient, in the right situation, probably doing home exercise directed by the physician is probably enough. And the second one is ice, right? Now we get this question, ice or heat, ice or heat. It depends on the situation. When we're talking about post-surgical inflammation, right? We make cuts, we go in there and mess things up, and then we put it back together. So we're gonna have some inflammation. So certainly no heat, because heat's going to bring more inflammation to the area. So you want to do heat, at least not early on. So we want to use ice. And so this study showed, again, another 5 studies that looked at ice and also looked at a couple of different things, but generalized ice. So 2 of the studies show there was improved pain and improved function if you use ice after surgery. Again, the problem is how much ice, when, blah, 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 right? There's all these details, but at least it gives an idea that ice is really cheap, right? And it's hard to mess up, although I guess you get frostbite, so you can get messed up. If you use ice, there's a pretty good data that ice is gonna help, and it's not really particularly expensive, except if you buy a cryo cuff, that might be expensive. Some insurance covers, some doesn't. I personally like the cryo cuffs. I think it's easier on the patient to keep the ice on, specifically the first couple of days, although it's not crucial. I think if you have someone that you know has a cryo cuff and you can use it, or if it's not going to cost you too much of a cryo cuff after surgery, then I think it's probably worth it, although that's not really what the study says. However, it does say that if you ice, you will feel better. You use probably less narcotics, which is important because that makes you feel better too. And 2, probably one of the studies evaluated an ACE wrap and an ice pack versus a compressive cryo cuff, right? The compressive cryo cuff, super expensive. I think it's about $1,000 for the compressive cryo cuff. That's what the athletes use, the professional athletes use. When they looked at ACE plus ice versus compressive cryo cuff, there actually did not appear to be any difference. Now, you can take that with what you want to, but it certainly gives us an idea that ice is important, and it probably doesn't matter how the ice is being applied. As long as you're protecting your skin and not getting frostbite, the ice is going to be beneficial. So this is interesting, right? An article that supports what we have always thought, which is ice is going to help. And in fact, this says this. Now, there is another thing that we call contrast baths, which is when people do ice heat, ice heat, ice heat. This did not mention that. I don't think, from my perspective and looking at the literature, that actually is helpful. It's probably not. I don't have any studies that I know of that support this contrast bath. So I think the key thing, if you're post-surgical, you need to use your ice as much as you can for the next, for the first 48 hours especially. And then after that, as needed. Cryo cuff probably doesn't matter, although I still kind of like it. I still think it is easier to manage how much ice you're putting on. Compressive cryo cuff probably doesn't matter, which is great because they're really expensive. Hope this helps. Please subscribe to the channel. Please give me any comments, anything else that you would like me to talk about. I'd be happy to. Also go to mybodyprotector.com. That's the website. That we have all some more different information on there too. Thanks so much and have a great day, and we'll see you next time.